People with untreated mental illness are 16 times more likely to be killed during encounters with law enforcement. That's why some cities are now deploying mental health experts to help diffuse these interactions. Parts of this report from Charlene Aaron are disturbing, so viewer discretion is advised.
But my babies, I don't know what to do.
This is body camera footage of Sonya Massey and police 16 hours before a gunshot ended her life on July 6th. The day before the deadly encounter in her home, Massey's mother, Donna, called 911 to report her daughter was having a mental health episode.
When's the last time you took your medicine? It's written down last night.
During her call, Donna Massey pleaded with police to not hurt her daughter. The next day, Sonya Massey called 911 to report a prowler. Officer Sean Grayson and his partner responded to the call. After searching outside, the officers entered the home, and the situation escalated. That's when Gracie shot Massey in the head, killing her. He faces multiple charges, including murder, and if convicted, faces a sentence of 45 years to life. Her death evokes painful memories and fear among some in the Black community.
A lot of people like that, like, oh, I feel safe when I'm around the police, or it's okay, the police are here. But sometimes for us, it's like we never know if we are actually safe.
Therapist Dr. Anita Phillips describes this as collective trauma, which can add to the distrust of police.
I had the opportunity to support a young Black woman who struggles with bipolar disorder, and she was experiencing a severe depressive episode, which had left her struggling with suicidal thoughts. I am on text, on the phone, supporting her, and suggested that maybe it might be bad enough that she needed to call 911. And her response was, as much as my suicidal thoughts are tormenting me right now, I'm probably safer if I don't.
Lisa Daly heads Treatment Advocacy Center, a nonprofit that advocates for those with severe mental illness. She points out the increase in people calling 988, the suicide and crisis hotline, since the new numbers launched in 2022.
There have been something like 10.8 million contacts with that system, which is a massive up, and that's been increasing over time.
According to Daly, police interaction with such callers often turn negative.
The likelihood of a person in a mental health crisis being involved in a fatal law enforcement encounter was 16 times higher than it was for people who were not involved in a mental health crisis at the time that they had a law enforcement interaction. So it is a pretty stunning statistic.
Treatment Advocacy Center also notes that many reaching out to police during a mental health crisis may be experiencing something called anosognosia, also called lack of insight. It's a biological condition that prevents a person from perceiving that they have a mental illness.
It's present in anywhere between about 40% and 50% of individuals that have schizophrenia and bipolar disorder. And the important thing to keep in mind in the context of crisis calls is that if a person does not believe that they have an illness, they will respond differently to law enforcement. This particular population is extremely vulnerable when they're in an interaction with law enforcement.
To better understand the problem, Daly's organization has created a specific database to track what she calls preventable tragedies. Research also shows notable racial disparities when it comes to policing and mental health calls.
You do definitely see, there is an increased impact to communities of color for really any kind of law enforcement. A significant factor is like communities of color or marginalized communities may be less likely to get the timely interventions that they need. So they may be in a situation where they're in the community for longer periods of time, not being treated, so that they escalate to crisis. And then once it gets to that crisis point, it's much more likely to result in a really negative outcome.
This, combined with the nation's overall mental health crisis, is leading more cities to enlist skilled health experts for assisting officers in the field. One example is the Support Team Assisted Response Program, also known as STAR, underway in Denver, Colorado. Instead of automatically sending police officers on each 911 call, any request related to mental health distress leads to the dispatch of a paramedic and licensed behavioral health clinician, something that could have meant a different outcome for Massey.
When they get that dispatch, they can go to the scene, trauma-informed care, medical assessment or triage, crisis intervention, de-escalation, transportation as needed, and then connection to different resources or follow-up care.
Despite being able to answer only half of the calls last year due to staffing issues, the program did respond to more than 7,000 calls. Results many believe are still worth expanding across the country. Charlene Aaron, CBN News.
This is such a welcome development to have the proper care for people who are in trouble so that the police are not viewed as some kind of enemy, but you truly can dial 911 and get help. Unfortunately, there are a few bad apples, and boy, have we ever seen it, evidence in our country today. And just in that piece, here's a woman with obvious mental health issues, already been reported for that. Why all of those reports weren't in the brains of the two officers responding to the most recent call is a mystery. But then she's shot to death in her own kitchen. And you wonder, what in the world? So can the police do a better job of policing themselves and instead of trying to cover up these mistakes, say, we need people that are present in the moment and not willing to kill an innocent, and how do we properly do that, properly screen for that? At the same time, how do we protect our police? Because many times they're facing cartels and gangs that have fully weaponed up, and what do you do in those situations? How do you have the right intelligence going into any encounter to know exactly what you're dealing with so that you don't overarm or underarm for whatever you're going to face? These are complex issues, but it's wonderful to see positive reactions to it. How do we have mental health professionals involved? If someone has a history of mental health issues, that's showing up in the police database. Let's make sure they're front and center in any future encounter. If you can have that kind of system, I think you greatly reduce the danger for police, but also for the public, and that would be a wonderful thing.